Hello, Jane Millar and Ian Green from SNOMED International, and thank you very much that you are with us with our webinar about nursing documentation, and of course, terminology play an important role. A couple of months, I think, ago, I talked to you, Jane, about nursing terminologies, and especially the collaboration of SNOMED International with the International Council of Nurses, ICN. And they published something that is actually abbreviated in almost the same way, ICNP, but it's actually a little bit different. It's the International Classification of Nursing Practice. And there is a collaboration. You are the collaboration lead at SNOMED International. And in that light, we had a couple of meetings before to smoothen the way of SNOMED to come to Germany. But now also other collaborations have started. So, for example, with ICNP. So, what is the essence of the collaboration of ICNP or ICN with ICNP and SNOMED?
So, thank you. I'm both pleased to be here and talk to you about the work we've been doing. We have been working with ICN for over 10 years. And because ICN and ourselves felt that there needed to be a close connection between SNOMED CT and ICNP. And so to do that, we produced together two maps, effectively, between ICNP and SNOMED for nursing interventions and nursing diagnoses. But it wasn't a complete map of ICNP with SNOMED. These were used a little bit, but ICN then undertook a review of its strategy as to how they wanted to work within the electronic health world and help their members participate in electronic health records, and really realized the advantage of the linking with SNOMED CT. And over a number of years, they undertook a project of doing an evaluation, which went right across the world, and came to the conclusion, and it was a very difficult one for them, that they needed to work much more closely with SNOMED International as a partner. And we are delighted that they decided they wanted to do that. And the essence of it is that we in the future will be producing and releasing, distributing ICNP on behalf of ICN. And it will be a separate component. It is integrated into SNOMED CT, the whole of that content, but also there will be a separate component so that it meets the needs of the whole community, so that if you don't have a SNOMED enabled electronic health record, then you can just get what we call a reference set, but it's actually a subset of SNOMED CT. Yeah. And you will be able to get hold of that, and it will just be the ICNP content. On the other hand, for those who have got electronic health records and are using SNOMED, they will be able to get it as part of SNOMED CT.
Mm-hmm. That's really great news. I also want to emphasize that the maintenance and the responsibility for the coding probably stays with ICN, so they don't go away. They are still responsible for from a content perspective. Is that true?
They totally have governance over the content. We have nothing to do with that. We are just the author. We author the content and put it into the set for them and into SNOMED, but they have total governance over it, and they have set up an editorial group that will manage it. So we have no say over that. And every decision as we author is reviewed by them and signed off by them. So at the moment, we are working to a static version of ICNP. We are producing the SNOMED equivalent of ICNP 2019, so that we have got a sort of marker in the sand, shall we say, and we have the first release. And after that, and we have been working very, very closely with ICN to get to that point, and we will be producing it in September in conjunction with ICN on behalf of ICN. But after that, ICN will make decisions about what content they want to be added to it, taken away, whatever. That's their jurisdiction, not ours.
Yeah. Okay.
So yeah.
I understand. Great. So the timeline is something like September, when you will make that release coming through SNOMED.
Yes.
And the future steps from that on is to have releases in sync with the SNOMED releases, probably?
No, we will be, with most of our reference sets, we go for annual releases. And I think that, I mean, as you know, ICNP has been produced every 2 years. So at the moment, and it will be entirely up to them what they want to do, but at the moment, the plans are for annual updates.
I think this is really great news, especially for Germany. They joined SNOMED International recently. You of course know that, and our audience also knows that now. One essential part is that this is not a let's say, buying a license, it's a membership. And membership actually also means that you have to engage, or you are encouraged to engage in bringing SNOMED International forward. And that brings me to Ian. You are the person at SNOMED International for clinical engagement. And my first question is, one of the questions I always hear from doctors and nurses is, why should we use SNOMED? Then we have to memorize the SNOMED codes and using them during patient care or whatever. So this is the rumor, and I hope you can add something to that, because it's of course not true that you need to write down SNOMED codes. So what is that from your perspective?
So I think from a clinician's perspective, certainly if you're familiar with other classifications such as ICD-10, where you do remember the codes, and the individual codes have specific meaning to the type of concepts you're referring to. SNOMED is completely different. So first of all, SNOMED is far larger than any other terminology. So even if you wanted to remember them, I would challenge anybody to actually remember that many codes. In the January release this year, we're up to 480,000 concepts. So that's a huge amount to remember. But also the structure of SNOMED codes are all numeric codes, and the codes don't mean anything in terms of where that concept sits in the terminology. It's there purely as a unique identifier, really for use in a computerized system. So if you're talking to a clinician using SNOMED, all the clinicians should really see are the words that they are familiar with appearing on their screen. Now, obviously, you know, as you can tell from my accent, I'm in the UK, and we publish the international edition of SNOMED in US English, actually. But equally, all of our member countries are developing translations where required. So you mentioned BfArM earlier, and I have some regular meetings with BfArM. And BfArM are working together with Austria, together with Switzerland and Belgium on a global German translation of SNOMED CT. And we're in the process now of updating a website which will enable people to firstly see the translation, which is important, but also to participate in some of those translation activities. So not quite crowdsourcing, but similar to crowdsourcing in the sense that we will be seeking feedback on some of those translations.
Yeah, I think the Germans also can learn from the neighbor countries. I had the pleasure to work for the Netherlands, and they translated most of the SNOMED terms, but that took 10 years. But they focused first on the really important things in the first row, and I think we can learn from that as well. Talking about clinical engagement or nursing engagement, there is a nursing clinical reference group. I think that's the name. Yeah. Could people from Germany also join that group and help find out what is next, what should be translated, what should be in, what should be out?
So the short answer is yes, but let me give you a slightly longer answer.
Sure.
So in terms of SNOMED International, we've adopted an approach for clinical engagement, which involves clinical reference groups. So we have set up a number of clinical reference groups, of which nursing is one of them.
Yeah.
The idea of those clinical reference groups really are for any clinician, or indeed anyone with an interest in that clinical area, to join the group. The group then advises and discusses nursing related issues in this case. The group doesn't, or the nursing clinical reference group doesn't advise on translations. So translation is separate. That's the first point. In terms of translation, we do have a translation user group that is also open to members predominantly from Europe, although it isn't restricted to Europe, but obviously a lot of European countries have their own languages. So translation is a bigger issue in Europe, if you like. But the nursing reference group is open to all. In fact, if you go on to just searching Google for the SNOMED International Nursing Clinical Reference Group, you can access the site. But the group is open to all. We'd actually encourage people to join. Nursing, and I would say this because I've got a nursing background, but nursing is a fundamental piece of the jigsaw of healthcare, and it is important that we get that content right. Nursing documentation accounts for a lot of healthcare documentation globally.
Good to hear, and I'm sure that there will be people from Germany who are willing to engage in the nursing clinical reference group. My last question is more or less for both of you, because I'm always excited hearing people from the international community working with, in this case, ICNP. And I think that Portugal is one of the countries who really uses ICNP. Are there other countries, maybe next to Germany in the future, that will engage or are engaged in ICNP in that term?
I think just picking that up, with the relationship we now have got with ICN, and the fact that ICNP is integrated with SNOMED, and we've got more nurses that are being exposed to electronic health records and SNOMED, this facilitates them being able to use some of their own language, that the language that they want for specific purposes related to ICNP, as well as other language, which is general, or it might be on a particular specialty, or they might be, we have an anesthesia group. They might work with the anaesthetists, they might work in theatres. So this is an opportunity to have the things integrated with SNOMED and using a language that they know and understand and works for nursing practice. So what we're finding now is that a number of countries that were thinking about where they went with nursing terminologies, they're now moving towards SNOMED. So we've seen, Norway, ICNP, we've seen Ireland, they're moving towards that decision. So we're seeing, ICNP is used in a lot of countries, but what you need is the national acceptance of it, so that people are using the same terminology. So we are seeing many more countries doing it, which I think it shows that the relationship is a success and will be a real positive for ICN themselves.
Yeah, I thank you for that, and I trust that Germany will also be a contributor to that.
I hope so.
I hope that, because we do have a strong community here. We have endeavors in creating electronic documentation for nurses for the electronic patient record, the nationwide patient record here. So I think that's really worth going into it. Thank you very much to you both for being with us. It was a real pleasure to have you here, to see you and hopefully the next time over a glass of wine or something like that.
We hope so too.
We
Thank you very much. Goodbye.
thank you.
Bye-bye.
Bye.